In this video, which is the first of two, I will be discussing the practical exam in order to obtain your CCT or Certificate of Completion of Training and therefore become a GP. When I sat my practical exam, it was called the CSA or Clinical Skills Assessment. However, due to COVID, changes have been made and the RCA or Recorded Consultation Assessment was introduced. There has not been a decision yet about whether to keep the RCA or revert back to the CSA post-COVID. If you want to check out the other videos discussing the exam to enter onto GP training and the written exam, the AKT, then check out this playlist here. These videos are perfect if you are considering GP training or if you are a GP trainee and want to know more about the exam. Perhaps you are in ST2 or even an ST3 and you're due to start preparing soon. And welcome back. If you're new, then a massive welcome to you. My name is Dr. Baptiste and I work as a portfolio GP. On this channel, you'll find lots of useful content to support you on your medical career journey. So this video outlines exactly what the RCA is, the areas of the GP curriculum the exam covers, including what cases trainees should submit, and obtaining consent, the format and structure of the exam, and new changes for this year. The second video will cover how to apply for the exam, including key dates to make a note of, how you can prepare for the RCA, how the exam is marked, and key information regarding results and feedback. These videos are perfect for you if you are considering GP training or you're a GP trainee and want to know more about the exam. As always, if you found value in this video, then be sure to give it a thumbs up and subscribe to the channel. What is the RCA? This is a summative versus a formative assessment, assessing the doctor's ability to use and apply their knowledge and skills, for example, clinical, professional, communication and practical skills needed for general practice. In comparison to the CSA, the exam that I sat, it uses pre-recorded video or audio consultations. It should provide evidence from a range of encounters covering most of the GP curriculum. It also allows for more focus on certain aspects of clinical care and expertise. What does it aim to test? The RCA focuses on testing the same areas of the GP curriculum 2018 as the CSA. For example, knowing yourself and relating to others. For example, provide care with compassion and kindness, applying clinical knowledge and skill. An example of this would be data gathering and interpreting findings to reach a reasonable or appropriate diagnosis. Managing medical complexity and long-term care. For example, being able to manage multiple comorbidities and polypharmacy, caring holistically and caring for the wider community. Trainees should submit a wide variety of cases. This is in order to demonstrate their knowledge and skills of cases that can be encountered in general practice, and of course the GP curriculum. What is the format and structure of the exam? The candidate submits 13 real-life consultations from their GP surgery, and most will be remote consultations given the changes made during the pandemic. There can be a combination of audio, video and face-to-face consultations, however. The exam, as you probably know, can be completed during a trainee's final year and cases must be submitted to the FourteenFish RCA platform. This is also where trainees submit their evidence for their portfolios. The RCGP advises that the cases should be sufficiently challenging. Ultimately, the trainee needs to demonstrate that they are safe and can practice independently. The cases are independently assessed by at least one examiner who are experienced GPs trained in assessing these cases. There are 3 domains like the CSA, and the candidate will receive a global judgment made by that examiner. Candidates must obtain and may upload consent from the patient to the above platform. The consents can also be written, paper or electronic or both, in which case it would be kept at the practice, or verbally, and this part of the consultation would not be counted towards the 12 minutes. Consent should be informed and the patient should not be coerced in any way. The trainee should obtain consent before and confirm consent after the consultation is over. So what changes have been made for the September 2021 entry? So changes have been made based on the feedback from a variety of sources, such as candidates and GP trainers and the wider training community. So to summarise, the changes are as follows. Breast lumps, apart from those associated with the postnatal period, are no longer mandatory. This was basically because the candidate would refer the patient via a fast-track clinic, which is appropriate but very straightforward and doesn't demonstrate any other management skills. Examinations no longer need to be assessed, and this was because candidates felt that they had to speak to the examiner rather than the patient. And with video recordings, the examination happens behind the curtains. Changes to what should be said about safety netting. So it should be appropriate, of course, and realistic, and sometimes candidates would use generic safety netting such as call 999 or go to A&E, which could upset or even confuse patients. Of course, this is not always appropriate. Consultation times have been increased to 12 instead of 10 minutes to reflect a more realistic picture that many real-life consultations do not occur strictly within a 10-minute time frame. So there you go, that is a very brief overview of crucial information about the RCA. The second video will cover a few more important aspects, including 10 top tips on how to prepare for the exam. If you found this video useful, then be sure to hit the like button and subscribe if you haven't already. I'll see you in the next one.